Welcome to Connective Care Education.
Changes in an individual that would give cause for concern. Observing and monitoring individuals enables prompt recognition of changes that give cause for concern. These may be concerns about an individual's physical or mental well-being. Changes could include breathing difficulties or change in breathing pattern, signs of sepsis, slurred speech or confusion, extreme shivering or muscle pain, passing no urine in a day, severe breathlessness, skin mottled or discoloured, signs of stroke, uneven face, drop in arm and slurred speech, signs of heart attack, pressure, tightness in the chest or arms, nausea, shortness of breath, cold sweat, fatigue and dizziness, recurrent and unexplained aches and pains, mood changes, expressing suicidal thoughts, lack of care for personal care, appearance and responsibilities, changes in sleep patterns, disrupted sleep, increasing reliance on alcohol, drugs, over-the-counter medication and cigarettes, social isolation and reluctance to interact with others, loss of interest in activities previously enjoyed, work performance dipping, extreme pain, difficulty in mobility, high or low temperature, unexplained cuts and bruises, changes in toilet habits, loss of bowel or bladder control, increased thirst, unexplained bleeding, confusion or memory loss, weight gain or loss, irritable, aggressive or oversensitive, and difficulty in concentrating. Observing, monitoring, recording and reporting changes. Where an individual has a diagnosed health condition, it is important that their condition is observed, monitored and recorded for a number of reasons. To monitor the individual's overall well-being, physical and mental. Monitoring and observation enables early identification of changes in the individual's daily routines, communication, behaviour and mood. To check on any changes in health, for example, shortness of breath, rashes. To monitor any changes in personal care by the individual, for example, a previously neat and tidy individual appearing unkept. To monitor the effectiveness of medication being administered, to identify if there are any side effects from medication, to indicate if any changes in medication are needed, to ensure a duty of care towards individuals is met, to identify concerns about an individual's health, to ensure conditions, for example, diabetes or blood pressure, are being controlled by medication, to monitor whether an individual is developing any mental health issues as a result of a physical condition, for example, anxiety or depression, to identify the needs of an individual and create and amend care plans, to share information with the individual to promote joint decision making. It is important that clear records are kept with full details, for example, date and time, for a number of reasons. To support consistent, safe and high quality care, to identify any trends, patterns or concerns, to evaluate and to amend care plans, to seek advice from professionals such as doctors, to be able to make decisions about medication, to clarify any complaint issues, to enable effective handovers to other staff and provide consistent round-the-clock care. Any concerns or changes in the health and well-being of individuals should be reported for a number of reasons. To access specialist support and enable hospitalisation, to be able to contact family members, to adjust medication, to avoid the spread of any infection or infectious illnesses, to be able to increase observation and monitoring, to investigate any possible neglect of duty of care or abuse, to amend care plans, to facilitate changes to routines for the individual, to plan and implement activities and routines to support mental well-being, to be able to access any specialist equipment required, to identify and record any near misses or mistakes. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 2, Worksheet 14. Links between health and well-being and safeguarding. Everyone has the right to live his or her life free from harm, abuse or neglect. Safeguarding is about protecting individuals from abuse or neglect and educating those around them to recognise the signs and dangers. It also involves promoting the welfare of the individual, preventing their health and development from being impaired, and ensuring that they receive safe and effective care. Abuse can happen anywhere, and the individual responsible for the abuse is often well known to the abused individual. The abuse or neglect can be intentional or unintentional. Why is safeguarding needed? The aims of safeguarding are both reactive and proactive. For children and young individuals, safeguarding is there to prevent harm and reduce the risk of abuse or neglect, address the cause of the abuse or neglect, prevent impairment of children and young individuals' health and development, ensure that children and young individuals grow up in circumstances that provide safe and effective care, promote an approach that concentrates on improving life for the children and young individuals concerned, take action to enable all children and young individuals to have the best outcomes, and to raise public awareness so that communities as a whole, alongside professionals, play their part in preventing, identifying and responding to abuse and neglect. For adults with care and support needs, safeguarding is there to prevent harm and reduce the risk of abuse or neglect. Put a stop to abuse and neglect where possible. Address the cause of the abuse or neglect. Promote an approach that concentrates on improving life for the individual concerned. Support the individual in making decisions and have control about how they want to live. Provide information and support in accessible ways to help individuals understand the different types of abuse, how to stay safe, and what to do to raise a concern about the safety or well-being of an individual. Raise public awareness so that communities as a whole, alongside professionals, play their part in preventing, identifying, and responding to abuse and neglect. The Mental Capacity Act principles. The Mental Capacity Act has been designed to protect and empower those who are unable to make their own decisions about their care and treatment. It focuses on the needs of the individual. It also enables individuals to plan ahead in case they lack capacity to make decisions in the future. It covers decisions about day-to-day routines and events as well as larger decisions, for example, about care or medical treatment. It recognises that an individual may not have the capacity to make all decisions needed for their care, but can make some. Involving individuals in decision-making supports their positive well-being, self-esteem and confidence. The Mental Capacity Act has 5 statutory principles which must underpin all actions and decisions made. Principle 1. A presumption of capacity. Every adult has the right to make his or her own decisions and must be assumed to have capacity to do so unless it is proved otherwise. This means that you cannot assume that someone is unable to make a decision for themselves just because they have a particular medical condition or disability. Principle 2. Individuals being supported to make their own decisions. A person must be given all practicable help before anybody treats them as not being able to make their own decisions. This means you should make every effort to encourage and support people to make the decision for themselves. If lack of capacity is established, it is still important that you involve the person as far as possible in making decisions. Principle 3. Unwise decisions. People have the right to make decisions that others might regard as unwise or eccentric. You cannot treat someone as lacking capacity for this reason. Everyone has their own values, beliefs, and preferences, which may not be the same as those of other people. Principle 4. Best interests. Anything done for or on behalf of an individual who lacks mental capacity must be done in their best interests. Principle 5. Less restrictive option. Someone making a decision or acting on behalf of a person who lacks capacity must consider whether it is possible to decide or act in a way that would interfere less with the person's rights and freedoms of action, or whether there is a need to decide or act at all. Any intervention should be weighed up in the particular circumstances of the case.